what is evaluation, biomechanical evaluation, what we look for, what are the objectives of the evaluation, and then how do we work with the client. What does my approach propose? My approach proposes simple things. Simple thing like get rid of pain is to fulfill the needs of the muscles. So we need to evaluate their condition to find out what are the needs. That's that basic, that's simple. You and I, we break molds because every day we shape our bodies by the way we use it, and the same for our clients. So then muscles atrophy, muscles tense up, muscles get loose and too weak or rigid, get stiff neck problems, very rigidity, a lot of rigidity, stiffness in the neck muscles, stuff like that. The back, the same, inflammation. So whatever the pain is, you take care of the muscular system, pain goes away. It's always the muscles. If there's a trauma, the short-term pain, the instant pain we get when we hit the ground or when we hit the elbow on something, or when we get the trauma, there's a specific pain, bruises and some micro injuries or more important injuries in the tissues. This gets fixed within 3 months or so. And if it lasts for longer, then the muscles have got a kind of a protective mode. They enter the protective mode by tensing up, and then they keep creating the pain we get after those 3 months. And so whatever pain you have, whatever pain you have to deal with your clients, you fulfill the needs of the muscles, the pain will go away. Whatever it is, the joints, tendons, the ligaments, the nerves, whatever feel your clients, 98% of the time you take care of the muscles, this will be enough. Of course, while you're taking care of the muscles, fulfilling their needs, you teach them to breathe, teach them to relax. This is gonna help too. It's gonna help the nervous system, metabolism, and hormones and stuff like that. This will all work together. So what do we look for when we do the evaluation? We will assess two main things. Length, each muscle in the human body has an optimal length. The muscles of the pectoral here, fibers of pectoral muscles, or the quadriceps, or the hamstrings, or the large glute or calves, they don't have the same length because they don't serve the same joints, the same movements. So what determines their length is the shape of the joints. Let's say the joint here in my shoulder, has a lot of range of movement. I can do this, I can go very far back, up and back at the same time. So this is possible because the shape of the shoulder is made for that. But what if I can't reach back like that, or very straight like this, or low like that? It's because the tissues are too short. Let's say my pec is too short, or other muscles restrict the movement of the joint because they're too short. That's the basic principle you've learned so far is you don't use it, you lose it. I don't invent that. I haven't created that. It's just how it is. So we're gonna take care of length of the tissues. That's the first aspect we assess and address. And the other aspect is density. Remember the fist test? You close your fist very tight in front of your face. After 10 seconds, you open up, it's whitish, and it turns reddish progressively. Why is that? Because tight muscles, rigidity in the muscles, tense muscles, they squeeze. Like, see the muscles like sponges. When they get tight together, the fibers, they crush the blood vessels, and blood can't flow. So there's less recovery. There's congestion around the area, creates pain, creates stress to the joints, etc. So what we need to do is find out the muscle's needs by doing the evaluation. So first thing first, the most efficient part of my treatment is always with stretching. Although many times, let's say 20% of the time, or maybe 30% of the time, we need to do massage and pressure points and stuff like that. So then when we do those massage and pressure points or other hands-on maneuvers, they target the density. So when we target the length, we stretch. If the muscles are too short, we stretch. Some people have, hyper laxity. Then we don't need to stretch those muscles. There will be more massage to do with them. So that's why there's maybe 20 to 30% of the treatment massage will be hands-on, and the rest of it is a lot of stretching. But of course, you can also give them half and half, stretching and hands-on work. That's up to you. My recipe is about that. I do about 50% assisted stretching after they did their own stretching themselves. Then I do half hands-on work to target the density, like pressure point massage and other hands-on maneuvers. Or I use my knee, my foot, my whatever I target. I have simple ways that are very efficient. So then I'm targeting, in those moments, I target the density, but I always start with the stretching because, I've had all types of pain before, and most of the time, let's say 80% of the time, easily 80% of the time, I have undone my pain, got rid of them on my own just with stretching. Sometimes I needed to add pressure points, self-massage and stuff like that, or like with a roller, with balls, with other accessories, self-massage accessories. And this was very efficient. And sometimes it was mainly, for certain types of pain, was mainly pressure point massage and stuff like that. So targeting density was more important. But most of the time, stretching will bring very quick relief, very efficient relief. So far, I've talked to you about length and density and why we do that. So we want to find out when I'm going to touch the person. If I put my elbow on their buttocks, let's say, for instance, or on their hips, or to the side of their pelvis, or to the thighs, I want to have feedback. So that's the density. You'll see more specifically in the videos. But for the stretching, it's simple. People will just grab their ankle to stretch the quad and be doing it standing. But I can also do it with them. If they first do it on their own, it feels good. They have 20%, 25% relief after doing twice both sides of quads, left and right. And then they do hamstring stretching and then glutes or stuff like that. And then they feel, wow, already like 40, 50% better after 15 minutes. Then you say, okay, now you deserve your treatment. And then they get on the table. Then you can be doing targeting those same muscles with stretching again, but you do it. How do I call that? I call that part of the treatment assisted stretching. Assisted stretching will be just the person is just breathing and letting me doing the treatment, and then I put the intensity they can take into the stretching, and I do for them. Is it the muscular chains of the legs with angles, no angles, straight, you'll see in the videos, in the next few videos. So this part is the treatment. But wait, if people get 20, 30, 50, 70% of relief when they first do whatever stretching I teach them to do, or you will teach your clients to do, that's also treatment, because that's what's so magic about the approach I propose. Because while you do the evaluation, you already have started giving care to the person. First, by doing it on their own, self-relief, because when they do their evaluation, they started already do self-relief. And then I do the assisted stretching when they're laying down at their table. And after that, I do the pressure points and massage, and I finish with that part. So it's like the 3 phases of the hybrid session. And that's how we get results like people can't believe. So basically, that's what the biomechanical evaluation looks like. We look for what are the needs of the muscles, and we target to respond. We want to fulfill those needs. And as we do the evaluation, that's already responding to the needs. Then I do the assisted stretching. That's also responding a bit more to the needs of the tissues. And after that, I massage them, pressure point them, or do the maneuvers that bring already good results in your own practice. And you'll get results like, wow. And people will be educated, will be empowered by what you did with them. And they will refer you a lot of people. So that's enough for today. For this video. If you want to watch the other videos right away, after that, to start self-evaluating your own body, muscle chain, muscle groups, or individual muscles, go for it, enjoy it, and keep smiling and deep breathe, easy and deeply. Take care.